Hi, I'm Dr. Lisa Goodman. I specialize in the Webster Technique for pregnancy. This technique picks up where a lot of obstetricians and midwives leave off. Through adjusting you during your pregnancy with precise controlled movements, we can eliminate aches and pains and set you up for an uncomplicated labor and delivery.
I first came to see Dr. Goodman. It's been about 2.5 months, and I had tweaked my sciatic nerve a little bit. I work on my feet all day and doing a lot of bending, and somehow managed to pull that. So initially it was an injury that I came and saw her for.
So I first found Lisa after a pretty nasty car accident when I was 26 weeks pregnant, and subsequently I was having a lot of back and neck and pain and discomforts and a lot of trouble at work.
I was having a lot of pain in my ribs, and my midwives didn't know what to do with me or what to do with the pain. So I first came to see Dr. Goodman to get help and alleviate the pain I was having.
The Webster Technique can be very effective late in pregnancy when a woman is experiencing pain. However, I recommend women start a course of treatment early in pregnancy to prevent any symptoms that may come along later.
The Webster technique that she uses is much less jarring, a lot of little motions as opposed to one big cracking. My baby always moves when she does the little round ligament thing, which is cool. It feels like he's getting more comfortable as well.
As soon as I found out I was pregnant, I came in to start getting Webster Technique because I know that it's a really valuable technique and a valuable tool for allowing things to go smoothly with the baby during delivery, especially during pregnancy as well.
Chiropractic care during pregnancy I feel like just kind of smoothed my life out. I'm already a pretty physically active person and I was doing yoga, but it sort of sewed everything together really nicely so that I was always comfortable. I was expecting a lot more discomfort and pain while I was pregnant, and I just didn't experience things at a really severe level that I've spoken to other women about, and I'm confident that chiropractic definitely helped with that.
In order to fully support you during your pregnancy, I combine the Webster Technique with nutritional, ergonomic, and exercise advice. I also provide an at-home visit to adjust you after your labor and delivery.
I like seeing Dr. Goodman because she gives me a lot of real hands-on treatment that I don't get from seeing my OB. OB's office, you kind of go in and you're in and out, and they don't really look at much of your whole body. They're just more concerned with the baby, which is great, obviously, but being that we're one and the same right now, it's nice to have Dr. Goodman really focusing on both of us as a pair.
Lisa's so controlled, and with small movements, she has a really great impact. So I kind of touted it with some friends who maybe weren't going to have chiropractic care during pregnancy, like encouraged them and told them that it was really helpful. So I mean, I would recommend it to anyone.
I feel like getting Webster from the very, very beginning of my pregnancy helped me along in my pregnancy because everything went smoothly.
I can't believe how much relief I've had in the past month and a half, and I really wish I would have come in a lot earlier.
While I was pregnant, receiving the Webster Technique was the best decision that I made. If you have any questions about chiropractic care during pregnancy or even want to ask me about a specific case, call my office and we'll set up a time to discuss it.